All right, online students, this is an announcement regarding how Tarleton State University is dealing with the coronavirus crisis and the announcement that you may have gotten about spring break being extended. I want to let you know what that means in our online courses. I am including slides that I made last week specifically for my org behavior course, and the reason why is because I recorded a regular lecture and I just tacked this on at the end of that lecture, and now I am seeing reason to share it with all of my classes, and I am just using those same slides. If I refer to org behavior, it also applies to research methods and capstone. I want to let you guys know what they mean by extended spring break, how that applies to online courses. All of my courses are online because I've been out for maternity leave, as you know, but it's different for online courses versus face-to-face courses. I want to clarify that. Also, I've been working on some research based on my background in Masters of Public Health courses that I took during my doctorate in public administration and public policy, especially public health policy, that I think is relevant. There is a lot of dangerous misinformation out there. When I recorded this just a couple days ago, there was much less information out there than there is today. Since I recorded this, I have seen dangerous things floating around on social media about how you can self-diagnose coronavirus by holding your breath and just random things that are not legit. And so I feel like there is a mandate to share this with all of my classes about our civic duty in what we say and what we share, and also our public leadership responsibilities as public administrators. So I wanted to share this with you guys, and if you have any questions, please take to the course Q&A board. Now, so let's talk about coronavirus, because obviously you're not hearing about that enough. I need to do some housekeeping for this course and steps the university is taking. I'm going to do a little public service announcement because we've got some problems with misinformation. There are some deadly, lethal consequences to misinformation. And I wanted to take this opportunity as a teaching moment to do a little talk about public leadership, civic duty, ethics, because I think that that's a good thing to talk about right now. I don't want to miss this chance. So, regarding this course, spring break is technically extended another week. We don't come back from spring break until the 23rd. Excuse me. The reason why they're doing this is because they need to give professors enough time to move their traditional face-to-face classes online. I mean, they have to have some time to do that. Thing is, ours is already online. And if it were something like I can just give you guys an extra week off, I would. The problem is we have material that must be covered, and it's already a struggle to cover it all within the weeks we have. And if I attempt to find a way to give y'all the extra week, it's just going to make the next week more painful. Unfortunately, there's nothing I can do to get you the material that you need for this class and give you a week off. Otherwise, I absolutely would. No, it's not fair. It's also not fair how when there's a snow day and classes are canceled, when you're online, they're not either. So that's a downside of being in online classes. But it's also an upside that we don't lose a week and we don't end up having things more painful. Because if this was a face-to-face class, those would be a disadvantage. Yeah, they get the week off, but they're still going to have to do double time to make up for that. So in spite of the fact that technically the university is not opening again until the 23rd, please follow the original syllabus. That way we don't get behind. Now, a little public service announcement. Unless your uncle, neighbor, cousin, dog groomer, boyfriends, sisters, ex-girlfriends, twice removed, whatever, unless they are an epidemiologist, they're not a reliable source for information on this. It is so brand new. Coronavirus has been around for a long time. SARS, MERS, yeah, this is a new iteration of that, and we don't know a whole lot about it yet. The people that know about it are people that study this, and unless you're listening to those people, you're probably not going to get good information. You might get secondhand information that they got from someone credible, but I would not go to them for information. Social media is the last place you want to go. It is just a, festering toilet of propaganda, and there's no accountability for it. People can share a Photoshop picture around, and they're not even ashamed, when they are told, hey, that's not true. There's no skin in the game. When it comes to experts not only, have they earned the right to be listened to because they know what they're talking about, they are not going to throw away that confidence, because if you are wrong about anything, then it brings into question everything that you've ever said. And you don't want that to happen. So that's why one of the reasons I don't talk about things that are not my wheelhouse. Even though on Facebook, everyone's an expert, right? I don't weigh in on things that I don't know a lot about, because I don't want people to not listen to me when it comes to something I do know a lot about. So I don't have an opinion on everything. I only have opinion on things where I know that I'm sufficiently informed. And, my accountability is I'm not going to throw away my credibility that I took years to earn by being wrong. Likewise, you shouldn't either. There's two schools of thought going on here. Some claim the virus is no big deal. Most people recover. Others are, acting all apocalyptic. The truth is in the middle, actually, and it's accessible. It's on the World Health Organization websites. It's on the CDC website. These are reliable sources. So I would go there. I'm actually writing an article on this right now, and because there's not a lot of peer-reviewed research out there about this yet, they are the best sources I have for my article. Now, let's talk a little bit about civic responsibility. Like I said, on social media, everyone is a self-avowed expert. And, everyone is, a constitutional scholar during the impeachment trial. Everyone is a climate scientist when Greta Thunberg was doing her UN testimony on climate change. Now, everyone's a self-avowed expert, yet they're not. That's the thing. They're really, really not. But it doesn't really matter that much. It's annoying to me. Yes, it's incredibly annoying to me. But it's inconsequential. Bob Jones from Anytown, USA, what he has to say is not going to change policy on climate change at all. What he has to say about, constitutional law is not going to give him a vote in the Senate. So it's a waste of time. One of the reasons why I don't engage on social media on things I'm not familiar with is because I don't want to waste my time. It's just a waste of time. It's inconsequential. It doesn't change anything. It doesn't even change minds. The only person that life changes is somebody that's mad that someone else is wrong on the internet and wastes their time, in the com boxes. So people are used to just saying whatever they want with no accountability. And it's typically not that big a deal. But when it comes to public health crises, what you say matters. It matters when you say it in person. It matters when you say it online. And the reason why is because I did my concentration on public health and bioethics at the UNT Health Science Center Med School with the real doctors, air quotes, real doctors. And I learned a lot about public health because I was in Masters of Public Health classes. And one thing is the health belief model. Health decisions are not made on facts, unfortunately. We want them to be. We want informed consent. But typically they're made on beliefs, whether those beliefs are true or not. And according to the health belief model, people make choices based on, and there's actually 6 tenets to this, 6 constructs. But the first 2 are, how likely am I to get hurt here, to get this disease or to get injured? And then how severe is this disease or injury? And the health belief model is used to apply to any decision that affects a person's well-being, physical or emotional. Emotionally, how much of a risk am I taking by asking out this person? Are they really likely to shoot me down? But then how severe is it? I can bounce back and ask someone else. So they might be willing to take a likely chance of getting shot down because they, even though the risk is high, they don't really think they have a lot at stake. And then imagine somebody's in a long-term relationship carrying an engagement ring around their pocket, and they're almost certain that their girlfriend is going to say yes, but they can't
work up the courage to ask because they just cannot bear to live with a rejection if the answer is no. This trade-off is how we make decisions on just about everything. And, I'm just driving down the street. Do I really want to buckle my seatbelt? How likely am I going to get into an accident between here and there? And I'm on slow roads, so it'd be a fender bender. It wouldn't be that big a deal. This is how we make decisions when it comes to sexual choices as well. I mean, yeah, how likely, am I to get an STD? I mean, this is actually been vindicated. The health belief model when it comes to communicable diseases has really been vindicated when it comes to HIV, because HIV, the severity used to be a death sentence. And it used to be something that people didn't think they could prevent at all. When they learned, hey, wait, I'm, not as susceptible if I use a condom, that changed their behavior. And then when it became a chronic manageable disease and not a terminal one, it's no longer as severe. And now with antiretroviral therapy, it's possible to be with somebody with HIV and not have virtually any risk of all of catching it. So see how changes over time in people's conception of, the risks of HIV and the severity of it changed behavior on that. So this is why these things matter. These are two things that people think about. And when you share unverified information that shapes beliefs on these two things regarding COVID-19, coronavirus, it will affect behavior, and the sum of that behavior affects society. So one person makes the individual choice to think, oh, well, there's this graph and, I haven't fact checked it, but, it said that this is not severe at all. It's like, nothing more than a cold. So it's no big deal. I'm not even going to bother, washing my hands or sanitizing or, not going to that crowded place. Or, they see something else that says, getting this is just an inevitability. It's, completely unavoidable. They think it's futile to do their due diligence to wash their hands, to avoid crowded places, to quarantine, whatever. So you see how unverified information on these things can affect behavior. And that can exacerbate the spread of this, and it can increase the death toll. Because while for most populations, it is not, there is severity, don't get me wrong. There's, sometimes lung scarring, and it's not a pretty thing. But typically it's only immunocompromised people and elderly people that are really desperately at risk here. So for most people, like, oh, well, I guess it's not as severe. But if they think it, they can't do anything but catch it, then they're saying that they can't do anything but spread it. Not taking proper precautions is a dereliction of our civic duty, because whether or not we would be able to bounce back from a disease, other people might not be able to. And I dropped my little boy off at his preschool and ran into one of the parents there that's in his 70s. He and his wife are in their 70s, and they adopted a young lady. Oh my gosh, she's so cute. I call her little Liz Lemon. She's got little glasses. Anyway, she's like 5 years old, and they adopted her from foster care. And this is a child that's obviously lost her parents originally to end up with a new family. These people are in the high-risk group, and I'm just thinking, this is a child that's already lost one parent. Oh, Lord, please protect their parents. She cannot lose more. People matter. And so thinking, oh, well, it doesn't really apply to me. It's not a problem for me. We have a civic duty not to risk the lives and welfare of other people. And that's one thing that I find to be quite appalling, actually, about all the social media saying, oh, well, don't worry. It's only the older people that are going to die. Like, they can hear you, just so you know. like their lives don't matter. So please do not share unverified things. Please learn the truth, only speak the truth, and do what you can to arrest the spread of this, if you can, which everybody has the ability to wash their hands, and not everybody might necessarily be able to stay home from work because, we don't have paid leave and things like that. I get that. Some things are harder than others, but the best you can, please do what you can to arrest the spread of this disease, because it's not so much the death toll. That is a concern. Losing people, that's a big concern. It's life or death. But also, we do not have the capacity. I work with the Texas Hospital Association. They supply me data for research. We don't have the capacity to deal with everyone sick at once. The flu, there's a shot for that. And because of that, we don't end up with more people who have the flu than we can deal with. Also, the flu's been around a long time, and so we kind of know how to deal with it. Not so much with this. This is brand new. And we cannot have our hospitals overrun with more people than we can take care of. So it's up to us to do our best here. So civic responsibility is incredibly important when we're dealing with things of this nature. But likewise, you are in an MPA program. You're getting an advanced degree in public administration. So you're a leader. In fact, our motto is all communities deserve good leadership, or great leadership, actually. We have our duties as citizens, but public leaders have more so of a duty during public health crises to lead by example. And so it starts with our civic duty, not making the problem of misinformation worse, not spreading it, not doing what we're supposed to be doing when it comes to social distancing. But beyond this, we are also mandated to make things better. It's not enough that, hey, we're doing our part not to make things worse. We need to make things better. So we're not adding to the misinformation. Great, would you like a cookie? Good for you. But beyond that, you should be sharing the truth, no matter how hard it is or what the consequences may be. And that's kind of difficult because, the truth is that the severity of it for children is very, very low. And because, my son can go to school and, if he catches it, it's not the end of the world. But then there's that little girl's father who's in his 70s. What if he spreads it to her and she gives him a kiss, right? So the truth is, I want to put people at ease by saying, hey, typically diseases are more damaging to young children. This one's not, but I don't want them to think, I can just, then I don't have to worry about my kid and I can send him to school. And I had to self-quarantine with him, actually. That's why it took me so long to grade your papers, is because I did not want to risk him having something like that. So when the symptoms passed and I gave him, allergy medicine and that cleared it up, I'm like, okay, we can do this now. But sharing the truth that makes other parents feel better, that, your kids are not at a high risk for this, and sharing the truth to young people that, hey, you're not really at a high risk for this. What they do with that truth might be bad. They might use that as an excuse to say, oh, well, I'm going to be okay, so I'm just not going to care about potentially catching it and spreading it. We still have to share the truth. And because this is an ethical issue, and I'm going to talk about that in the next slide. There is a skill to instill public trust and not incite a panic. Yeah, so you want to give people information that they need, but you don't want to add to hoarding that leads to shortages, that leads to price gouging. You don't want to create problems that don't yet exist because people are fearful. This can be done without costing citizens to think everything is well and not take the proper precautions. So it's possible to, instill a sense of trust in the public that, yes, this is a disease, it does have consequences, but here's all we're doing to contain it. Here's all you can do to contain it. It's possible to do that without giving people the false impression that, everything's fine, it's no big deal, don't worry about this. And sadly, that is what I have seen from this administration. Being so, this is going to go away, it's going to go down to zero. The statements about this have basically told people, don't worry about it, it's no big deal, when it really is a big deal. And I don't think that that is an ethical or correct thing to do. Let's talk about that a little bit more. Now, let's talk about some ethics when it comes to being a public leader during a health crisis like this. Integrity. We are not exempt from what we tell others to do. So, like I have told you to not risk other people, like I have told you to wash your hands and practice social distancing and things like that. This means that I have to do that myself. which is a bummer because I totally had tickets for a concert tomorrow night that I was super looking forward to. And I had a feeling that they were going to cancel it. And I was so bummed about thinking, man, I should probably not go. I should probably not go. But he's not even on tour right now, y'all. He's just doing this special concert. Man, yeah, it's a bummer. They canceled it, which was the absolute right thing to do. Absolute right thing to do. And also, save me from eventually having to say, oh man, I'm just going to eat the cost of these tickets, which is what I should have done as a person of integrity. But I get that it's hard. It's so easy to do as I say and not as I do. And really, we have to lead by example. So you have to have integrity in that if you suggest that these are the ways that we need to act to deal with a crisis, we need to act the same way. It's kind of the equivalent of when we have all of these politicians that say, oh, now, we got to tighten our belt. We got to, pay more in taxes, or, we got to spend less money because we're having a budget crisis. And that yet they never show any sort of restraint when it comes to spending for themselves. Yeah, that's annoying, isn't it? Yeah, it's hypocrisy. It is. Integrity is important. Likewise, communication. Citizens have the right to be informed, and it's up to the leader to inform them. If they don't get information from us, they're getting information, and they might not be getting it from the best sources, and the information might not necessarily be true. Likewise, that means we have to be honest, and citizens have the right to correct information upon which to base their decisions. Regardless of how they might misuse that information, like I said, being told the truth that, it's really not that severe for young, healthy people may lead people to make a foolish decision to not do what they're supposed to do to arrest the spread of it. Telling them that it's not a big deal for children. They might continue to send their children to school, even if their child shows some symptoms of it. We cannot control what others do, but we can control what we do. And leaders have to tell the truth, even when it's uncomfortable for them to do so, even when we don't want to. We've got to give accurate information. And this is important because the address to the nation, President Trump, there were 3 falsehoods in a prepared speech. And that shocked me. Okay, this is not something off the cuff that you got wrong. There are 3 things that were said in that speech that have been verified to not be true. They are not limiting the import-exports from Europe. We are not covered when it comes to coronavirus treatment, only testing. I can't remember what the third one was. But this is important. People need to trust that what we're telling them is true. And not only can't we be dishonest, we also have to be diligent to make sure that we're not mistakenly passing along misinformation. And then there's equality. This is important. A leader recognizes that all citizens are equal, all lives matter, none are expendable. Utilitarianism is basically where you say, okay, yeah, we might have to let bad things happen to this group, but the rest of us would be so much better off. So yeah, why don't we just kill that homeless guy over there, and that way we can use their organs to save all of these other people. Yeah, how important is that? It's awful. And I'm hearing this argument a lot when it comes to this, that, it's nothing to worry about because, most people recover. Well, say that to the people that don't recover. Say that to people that are immunocompromised. Say that to people who are elderly. Say that to people who have any sort of lung issues that are on supplemental oxygen. My mother passed away in 2015, but she lived the last 10 years of her life needing O2. And people hear this. And, what does it say to citizens when we suggest, to make other citizens feel okay that, oh, you're okay, it's just these guys? Well, they're thinking, next time will it be me? And also, they should have every right to be disturbed by that. So we need to remember the virtue of equality. Every demographic is important. And then finally, accountability. Owning up to the consequences of our decisions and making good faith attempts to remedy mistakes. There is a cruise ship that the president does not want to let people disembark because he does not want the numbers of our case count to go up. And he says, quote, because it's not my fault. People first, people matter first, not, saving yourself from blame that doesn't belong to you necessarily. But a lot of things that are happening here are consequences of budget cuts and gutting our global health response that President Trump is responsible for. So it would be important if there was owning up to that, but also the willingness to be accountable and take responsibility for taking care of people, even if it might put them in an unflattering light. So these are just a few things that came to mind that we need to keep in mind when we're dealing with a public health crisis like this, and what is expected of us as public leaders. So if you have any questions, please use the course Q&A board. It is there for questions. If you email me a question that belongs on the course Q&A board, I am going to not answer it and tell you to put that sucker on the course Q&A board. So, because that's where it goes. So let's save a step and skip the middleman, which is me, and just put it straight on that course Q&A board. I'll get an email telling me it's there, and I'll be able to answer it, and everyone can see the answer. So I hope you guys have a great spring break. Please stay safe. Stop freaking buying up all the toilet paper. Other people need that. And just take care of yourself, because I care about you, and I want this crisis to pass as quickly as possible. And I think the only way to do that is if the individual choices we make as people add up to societal good choices. Individually, if we all don't do what we're supposed to do, certainly this thing is going to spread. So make sure to do your part. Alrighty, have a great week, y'all.